So let's talk about sort of the recovery of a facelift, and let's talk about the psychological effects. We'll talk about the physical effects, but is
Sure.
it sort of a lot to take on for patients, or does it depend more on the patient?
I find that it is a lot to take on. And I find many women are a little nervous of it. They're not quite ready for it. It is daunting. It is the stigma. They say, I never thought I'd be doing this. My mom
Mm.
had this and I thought I will never do that. But here I am. There's a process that women go through, I think. And, the wheels start kind of turning like, I don't know. They go to the mirror and they do this and they go like this. Oh, wouldn't
Yeah,
that
they're
be nice?
probably, yeah,
So yeah, maybe a little
a
this,
little
that.
pull.
So they go through that, and then, they probably have to get through the leaps of like, what does my husband think? What do my kids think? What do my friends think? There's all of that, opinions. And then they finally get into the office. Thank goodness. They say, I'm just going to get the information. At that point, I'm so honest about what it is all about and how, if they're a good candidate and things like that. So then they have the facts, the information. And then some will jump on it. Some will just say, I'm ready for this. Let's go. They can't
Hmm.
wait. Some take some more time to process, to get used to the idea. It just depends on the patient, but it is a lot psychologically to put yourself into that mindset. Like, I am the woman who's going to have a facelift.
Yeah.
But what you have to remember, at least in my hands, and I tell women, I can look them in the eye and say, with 200% certainty, when this is all done and you're healed, you are not going to look weird. You are not going to look pulled. You're not going to look like someone else.
And so, what are sort of the phases, maybe mentally and physically, that women or patients, because there's male patients having
Uh-huh.
facelifts too, that they go through on that journey to seeing their final result?
Yeah, so that's a whole new territory and category. And, it's scary because you're a layperson and you don't know. So obviously, after surgery, and you will be swollen, you will be distorted a little, the tissues will look strange. So we have to really stress that that is going to be a couple of days of really feeling a little bizarre. We like to really prepare people for that, guaranteeing them that once it's all done, it's going to be great and perfect. But we do tell them that we are going to be there for them, through every step of the way. Through the swelling, through the bruising,
The
yeah,
paranoia
through
or
the
the panicking?
emotional ups and
Yeah,
downs.
because I think there
Exactly.
is that, for even if it's a 24-hour phase, if you're the one going through it where you're feeling like, oh my God,
Scared.
what have I done? Everybody goes through that. And it doesn't matter whether you're having a tummy tuck or you're having your face done. Everybody has that kind of like, what have I done to myself? And I
Yeah,
walked in
it's
willingly.
normal. It's totally normal. It's an elective surgery. Now, what did I do? Is this going to heal up properly? So, yeah, we are there reassuring, helping people get through those phases. And, the phase can last more than a day. It can sometimes last a week or two, just
Hmm.
depending on the person's level of anxiety and things like that. Everyone is a little bit different. So we just kind of try to manage that as we see, as the patient kind of needs it. If we need to see them more in the office, if I need to give them my cell phone and say, hey, give me a call, send me a
Hmm.
picture if you're worried about this or that. I find that that's very effective. I find that the best way to manage that is being available to people, knowing that they're not alone, knowing that
Hmm.
they've got a whole team of providers that are there.